What is uterine artery embolization and when is it needed?
So in this procedure, access is taken to the uterine artery through either the femoral or radial approach, and then the uterine arteries are selectively catheterized with the microcatheter, and then embolizing particles are delivered selectively into the fibroid feeders, thereby cutting off the blood supply. This results in reduction of the blood supply and gradual shrinking of the fibroids and reduction in the symptoms of the patients.
Why is uterine artery embolization better than conventional modality of management?
UAE for fibroids is as effective as surgery for treatment of fibroids. UAE for fibroids involves a shorter hospital stay, patients recover faster and can resume their normal working at the earliest, and it is tolerated better than open surgeries, and there is no scar involved in uterine artery embolization for fibroids. In fact, now there are multiple society recommendations, including the Society of Interventional Radiology, American College of Obstetrics and Gynecology, the RCOG, all suggesting that uterine artery embolization for fibroids must be considered as one of the first line treatments along with surgery, and should be offered to patients who are suffering from symptoms of uterine fibroids.
What is your clinical experience and present literature evidence of this procedure?
So my personal experience is I have performed UAE for fibroid and non-fibroid indications of approximately about 150 to 200 patients, and the success rate is close to 99% of them having symptom relief. It's a good number. And literature evidence, there are multiple trials that have been done across the globe. To name a few: Hopeful, REST, FUME and FEM trial. So the conclusion of all these studies is that uterine artery embolization is as effective as surgery to alleviate symptoms of the uterine fibroids, and the hospital stay is significantly less in case of uterine artery embolization, which is between 1 to 2 days versus about 5 days for the surgical methods, and the patients recover faster and get back to work sooner.
What is radial approach and how is it beneficial?
See, conventionally the embolizations, all embolizations including uterine fibroid embolizations, were done from a femoral approach, where the puncture is made into the artery in the groin of the patient. So after this procedure, if we have to close the site that we have entered, we will have to press that area for a few minutes and then immobilize the patient's right or left leg, whichever we have accessed the artery from, for 6 hours, or if we use a closure device for about 2 hours. And given the fact that the patients are also going to have post-procedural discomfort in the pelvic area, immobilizing them for 2 to 6 hours was really discomfort. So in case of radial approach, where we access the radial artery in the at the level of the wrist, and from there we do the procedure accessing through the aorta and then going into the uterine artery. So the patient can be mobilized right after surgery, and the discomfort in the pelvic area is much less, and the patient's pain is significantly less in the groin area.
What is your message to the general physicians about managing these patients in their OPD post-procedure?
When the patient is discharged from the hospital, either on the same day or the next day, we cover them with adequate painkillers, analgesics. So sometimes they can have recurring pain, and if the pain medications are discontinued or if there is new onset pain, so most often this can be managed with oral analgesics. So the general practitioner has to remember that pain can come back and can be managed. And the worrying symptoms that the general practitioner has to look for is either a foul smelling discharge or recurrence of the vaginal bleed or any other abnormal symptoms. Some amount of fever is expected, especially in larger fibroids, and this is called as a post-embolization syndrome. Generally, we call the patients for follow-up at 1 month and 3 months to see how their symptom resolution and to look for any other symptoms.